Hello students, today we will discuss about the routine newborn care and resuscitation. So routine newborn care after birth refers to the standard medical and supportive care provided to all health newborn immediately after the delivery. So regardless of the place of the birth, the goal is to ensure the newborn's well-being, support adaptation to life outside the womb, and prevent complications. So that all purpose we have to do routine newborn care for every child, every fetus after the birth, and if there is needed for the resuscitation, then immediately we will perform the resuscitation. So how to perform the routine newborn care? We will start the procedure over here. Firstly, we have to take two warm towel which we have to already warm in on the radiant warmer. The radiant warmer we will on before the 20 minutes before the delivery and warm the baby's cloth. And when baby is delivered, we have to place the baby on the mother abdomen and dry baby with a clean towel right after the birth, and remove wet towels and wrap the baby in a warm dry cloth after the birth. And during this procedure we have to assess the baby's extremities and eyes and mouth. If there will be having any abnormality, any meconium in their mouth, we will suction firstly in mouth and after that the nose, and remove, and we have to clean the eyes, inner canthus to outer canthus, and keep the baby warm to prevent hypothermia, low birth temperature. Just after that, remove wet towel and wrap the baby in warm dry cloth and place to the baby for the mother abdomen for skin to skin contact. So place the baby on the mother chest, skin to skin contact, and with the at the time of giving skin to skin contact, also recommend for the breastfeeding as soon as possible, otherwise immediately after the birth. This help with warm bonding and breastfeeding initiations, and this is also prevent from the hypothermia if we will give the skin to skin contact just after the birth. Clean the airway gently if they are needed, and we will place that baby at the abdomen of the mother, at the chest of the mother, and immediately the mother will be when the baby will be sucking the breast, and with the help of this process, the oxytocin hormone automatically release the body of the mother, which is helping to contract the uterus after the birth and separation of the placenta. This is also the helping is very clearly. You can assess the check if the baby is crying or breathing normally. You should assess firstly. If not being newborn resuscitation immediately, then clamp and cutting the umbilical cord. Wait for 1 to 3 minutes before cutting the cord. That is called the delay cord clamping in recommended unless urgent care is needed. If you need urgent care, then immediately you should cut the cord. If there will be no need any these type of resuscitation, then you should wait for 1 to 3 minutes. We can call the delay cord cutting. So then clamp the cut and cord using sterile equipment. After that, then you should start the Apgar score. This is done at 1 to 5 minutes after the birth, and it evaluates appearance, skin color, pulse, heart rate, grimace, which is called the reflex, activity, the patient's activity, fetus activity also you should observe. After that, you should observe respiration, breathing efforts. These all things you should assessment firstly. Then early initiation of breastfeeding. After that, we should start the early initiation of breastfeeding. So encourage breastfeeding within the first hour of the life after the birth. And colostrum, the first milk is called the colostrum. So first milk is very beneficial for the baby. You should provide the first milk before giving anything. We can also say the first vaccination of the baby, that colostrum. So identification, apply the identification tag to the baby to prevent mix up. Then you should give the vitamin K injection. given to prevent bleeding disorder in the newborn. So you should give the vitamin K injection and eye care. So how to prepare the tray before the resuscitation? Two towels, warm towels, cap, socks for prevent the hypothermia. After giving the resuscitation, we should apply this ambu bag. Ambu bag we should apply if needed. But before prepare this all equipments, all articles, we should check the function of ambu bag. How to check? We can show this, you can see this ambu bag. When we have to inflate this ambu bag, the sound become like a air sound becomes out from this ambu bag, and self inflate also check. When you have to press this ambu bag, then self it inflate, you should check firstly, and you should check the all functions regarding the ambu bag before giving the patient. And C shape, we can apply the C shape with the covering of baby mouth and nose, and we should apply, and we should check the sound of the ambu bag and self inflate of the ambu bag. After that, stethoscope for checking the baby's pulse rate, and mucus sucker या mucus extractor which is helping to remove the mucus from mouth and nose. So this is also helping. And one sterile scissor for cutting the cord, and gloves which is already we have to wear after washing the hand. So this all things you should prepare before giving the resuscitations. This is very important. And cloth and two warm towel we should already warm in front on the radiant warmer. So resuscitation is very important for giving the in emergency at birth. A baby transitions from the getting oxygen through the placenta to breathing on their own. Sometimes the process does not go smoothly due to prematurity, due to birth asphyxia, due to infection, due to maternal complications, due to prolonged labor, due to meconium stain, amniotic fluid. So we will start the resuscitation. Firstly, you can see when we have to give the ambu bag to the patient, to the neonate, you can see the chest will be raised. At the time of ambu bag, you should observe with your eyes, and you should check the raise the fetus chest. When you have to give the ambu bag, the chest of baby is raised. You can see this picture. When we have to give the oxygen, the baby chest is raising. This raising you can observe. This is the right way to give the ambu bag. See, we have to make a C shape with the covering of baby mouth and nose. And when we have to give the ambu, the patient, the fetus chest is raising. The fetus chest is raising. You can observe like that. You should give the 30 seconds. Till 30 seconds you should continue that ambu. And after that, firstly place the baby under the radiant warmer, then position head in sniffing position to open the airway, and apply the shoulder roll. Clean airway only if needed. Mouth first, then nose. Dry the baby quickly and remove wet towels and cover with a dry one, and stimulate, rub back or flick feet to encourage the breathing. So you can see at the time of chest compression, we should give the 3 compressions to 1 breath. We have to take the help from our assistant, and place your hand behind the back of the baby, and your thumb is between the two nipples on the sternum, and we have to say the 3 compressions: 1:2, 2:2, 3:2, and 1 breath. 3 compression, 1:2, 2:2, 3:2, and 1 breath. Like that you should give the compression CPR to that baby if needed. So use 2 thumb technique for the compression. With this technique and compression 1:3 of the chest depth, and this depth is 1/2 inch to 1 inch. like that you should start it. So you can see again, firstly you have to try the baby, and this procedure you should finish within a 1 minute, 60 seconds. Within 60 seconds you should finish this procedure if baby is not crying after the birth, and start the resuscitation immediately, and remove the wet towel and wrap the dry towel, and first suction you should done on the mother abdomen, firstly mouth, then nose, and remove the wet towel of the baby, and immediately cut the cord, and take the baby and place on radiant warmer immediately, like this. You can see in this picture, wrap the baby and place on radiant warmer immediately. This procedure you should follow immediately after the birth within the 60 seconds. After that you should place the shoulder roll for clear the trachea area, for giving the ambu bag, and rub the patient behind and fling the patient for the resuscitation. If baby is not responding, then again you should give the suction, firstly in mouth, then nose, and repositioning. After that the baby you should give the reposition on the shoulder. So you should repositioning on the shoulder and start the ambu bag immediately, with making the C shape of ambu bag. See in the video. Give the ambu bag like this. Make a C shape and observe the chest, if baby chest is raising or not. Nose is also covered and full mouth is also covered with the help of C shape. See, check the chest of this baby. It is raising or not. You can feel the chest. So this technique you should use for the 30 seconds or 60 beats. You can give the 60 beats, the HR remaining the 60 beats per minute after the 30 seconds of the effective PVB. We can say our assistant after the 30 second, she will check the pulse rate of that baby. It is above the 60. When we have to give the 30 seconds till 30 seconds continuously, then we should start again the same procedure. For the 30 seconds. After 30 seconds, you can observe if baby is not responding good, if the respiration, if the pulse rate is not becoming 100, then we have to start the chest compression. At least 3 cycles you should give. The duration is 30 seconds. Again you should start the ambu bag and check the patient chest raise or not. 30 to 40 cycles you should give, otherwise till 30 seconds continuously you can give the ambu bag, and again you should tell your assistant to check the pulse rate of that fetus. If it is 100, if it is below the 60 till now, then we should apply the cap. If baby is revived, the baby pulse rate is 100, then you should apply cap, socks, and we should remove all unnecessary article and wrap the dry towels, and after that we will start the routine care of newborn. We should take the baby and place on mother abdomen immediately for further procedure like breastfeeding, skin to skin contact. We should start after the resuscitation if baby is revived, and we should also call the pediatrician for checkup of this baby. These things we should provide to the baby. So like that we should provide the resuscitation of the baby and routine newborn care. After resuscitation, if it is effectively, then routine care is started.